Well, thanks everybody for coming out today. A lot of my presentation is going to touch on things that Dr. E covered. We're going to go a little bit into more detail on certain elements of those. I really wanted to break this down and give you kind of manageable ideas about how you can start to implement some of these pieces into your life. All right. So again, my name is Helen. I'm an older adult behavioral health specialist. Have any of you heard about the Older Adult Behavioral Health Initiative of Oregon? No. Well, it's the first time, I guess. So basically, this initiative was started about 3 years ago, between 3 and 4 years ago. A bunch of people, really high up people, got together and said, you know, we really need to do a better job. We need more services for older adults and people with disabilities when we're looking at mental and behavioral health services. And we really need to improve the services that we're already offering. Not only that, but we really focus on looking at barriers that prevent people from accessing the services that we already have. And the concept is that we want anybody who touches the life of an older adult or somebody with a disability is that we want to make sure that they're competent and well-trained in delivering services specifically to those populations. So again, I cover Linn and Benton counties. I come to you today with a little over 20 years of experience in the medical, social, and human service fields. My dad was actually a family practice doctor, so back in Ohio, I think as a toddler, I went around and participated with his going around in the hospital and making his medical rounds. So I don't count that in my experience, but I know a lot about hospital food, so. All right, so learning objectives. I want to start by talking about what I mean when I say cognition, because this whole slideshow is really about the ways that our brains decline and change as we age, and also the things that we can do to preserve those functioning and abilities. Next, we're going to talk about what is normal aging of the brain. What can we expect? What's something, you know, the things that are going to happen to all of our brains as we get older, and then also some things that can happen that are more related to disease and illness, maybe some things that we can't quite control. So then we're going to talk a little bit about, you know, why you're all here today, why this topic is really important to be discussing and learning about, and then we're going to go into depth on some of those guidelines for how to integrate brain protective behaviors and brain health behaviors. So when I say cognition or cognitive functioning, our manual for behavioral and mental health providers, it's called the DSM. It's kind of our Bible of diagnoses, all things that can, you know, change and go wrong with our brains. We break down cognition into 6 different categories that capture kind of the pieces of the brain and how they function differently, and then we also want to do that because each piece is correlated with different types of functioning and different abilities that we have as human beings. So I'm going to briefly go through each one and try to give you an idea of what that might look like as far as how it could affect functioning or what that looks like in functioning. So the first category is executive functioning. You might hear that term a lot if you know anyone who has autism. We talk a lot about executive functioning. So I would say the reason why you're all here is a lot to do with the fact that you have good executive functioning. You were able to plan, maybe you wrote this date down in your planner, you looked at your clocks, you set alarms, and you made sure that you got here on time. You used executive functioning to do that. Next, we see language. This is pretty self-explanatory. It involves us using names and labels for everything in our world. So we have all those stored. I think Dr. E touched on that. We have all those names and labels stored inside. As we age, sometimes it takes us longer to go through all of that and retrieve what we need. So when we talk about word finding and fluency, it's the ability to pull that information out and string it together so that we can communicate. It also involves us being able to understand both written and spoken language. The next section is social cognition. So this is basically, I think of it as like my mom in my head, like telling me you can't wear that outside because that's not, you know, people will laugh at you and think you look funny. And so it focuses on kind of social functioning, social behaviors, how we know what's appropriate. It also has to do with us being able to recognize emotions and to be empathic creatures within, you know, human interactions. So when we lose that, sometimes you can see that as a part of a type of dementia called Lewy body. So there are some different diseases and things where you see losses in that area more often. Learning and memory. So this is just our ability to learn and take in new information and also to be able to remember it and also creating memory. We have complex attention next. So this is our ability to maintain focus, and on top of that, be able to entertain a multitude of stimuli in our environment and to be able to manage all of those things happening at once. Some days I'm better at that than others. Usually it involves more caffeine, but we can see some declines and changes as we age, okay? Perceptual motor function is our last domain, and this involves our motor tasks, hand-eye function, hand-eye coordination, and recognition of faces. So when we think about life functioning and how this might impact our ability to live independently, can you send that message from the brain to the hand to write a check, to pay your bills, right? It's something as simple as that we're like, we don't really need hand-eye coordination. Well, you really do. So be thinking about these cognitive domains as we go through these so that you can really tie in. We don't want you to be experts on all the parts of the brain and everything by the end of today, but being able to understand how this correlates with actual abilities and how it could impact our quality of life as we age. So causative cognitive impairments, I think most of these were touched on too, but all of these can range as far as the level of impairment, which we can think of as a level of maybe disability, from mild to severe. So somebody could experience a stroke and it could be relatively minor and not leave any long-lasting deficits in cognitive impairment, or you can see that at the more severe end of that spectrum. So traumatic brain injury, we call it TBI because it's really long, but we think of that as injuries that people experience in combat, but we also know really physical sports, boxing, even competitive cheerleading, but certainly football, things like that. When our brains get jostled around too much, we can see the effects as cognitive impairments later in life. Also, brain diseases like Alzheimer's and other forms of dementia, medication side effects. When I was at Geary Street Clinic, I would have patients come in that just maybe started a new antidepressant, and they would say, I couldn't find my words as well after I took it. Certainly if they were using like a benzodiazepine for anxiety, I would hear people saying I couldn't retrieve words, or I couldn't quite remember what, the outfit I wore the day before. So some of those things you can adjust to after you take a medication, and sometimes they're just maybe not a good fit. So also depression, anxiety, mental illnesses, mental diseases can impact our cognitive functioning, and vitamin deficiencies. Namely, B12 was the one that kept coming up in my research. Cognitive brain performance peaks on average around age 40. What do you guys think about that? I'm not 40 yet, so it sounds good to me, but I'm getting close. So I did a lot of research to put this PowerPoint together, and I found things saying, some people experience the first start of cognitive decline in their mid-20s. That made me kind of sweaty and nervous. And then I saw some things where they're saying, we don't have a lot of significant cognitive decline until our 60s. So this is just kind of a median number, okay? But it kind of shows you we're peaking younger than I would have guessed, and then we're beginning those normal age-related cognitive declines at around age 40, give or take, and we're all different, so that can look very different for people, but something to keep in mind. So now we're going to look at some of the ways that our brain changes, both physically and on a chemical level. So our gray matter, the big squishy thing up there in our heads, we actually lose some volume. It starts to shrink, okay, as we age, and this is normal. And we specifically see shrinkage in pretty important parts that involve learning and enabling us to perform mental activities that are fairly complicated. We also see potentially some increases in neuroinflammation, which is just a fancy made-up way of saying inflammation in the brain. We'll talk later about some of the things that can increase that and also some of the things that can help control and eliminate that inflammation. We'll see blood flow in the brain decrease, which we know blood is a medium that we need to do all sorts of important things in our body, but certainly in our brain. So I think that's why we see this connection between what's good for your heart and your blood vessels is good for your brain, and vice versa. So we lose some communication between our neurons or our nerve cells. They talk less, and some of those communication points break down. So when I talk about keeping the lights on, this is how I conceptualize. Some of those lights go out, right? And there's some things that we can do to change that. And then we see some changes in neurotransmitters and hormones, okay? And that can look like changes in mood, things like that, when we see those chemicals change. So why are we all here? I think there's lunch after, but as far as the PowerPoints go, we want to talk about brain health. I really want to talk about brain health because it is a vital part of our aging, our quality of life, our ability to live independently, to be able to do basic functions and tasks that make it so that we can lead healthy and fulfilled lives and age in place as long as we can. So I think that's why I really wanted to do this talk, is because I think it's such an important topic. It's starting to be talked about more and more as we find out more information. But now we are going to go more in depth on what we can do, right? Enough about the problems. Let's talk about what we have in our control. So learning something new. We want to engage the brain just like anything else. You take your body to the gym, you work it out. We want to take your gray matter to the gym and work it out, right? So we do know that, like Dr. E said, we don't have a set number of nerve cells, okay? We can create these. Our brains are incredible. They're flexible, they're dynamic, and we can keep growing them and strengthening them as we continue to age. So when you learn something new, you are potentially building new synapses in your brain, okay? And as I was doing my research, I found a funny little comment that someone had written, and they basically conceptualized this as the more reserve you build, the more you have to lose before you lose it. And I was like, okay, that makes sense to me, okay? So we want to squirrel away all these little nuts, and then as they start to go away, right, and the lights start to turn out, we have a lot more in reserve to protect us. So the quote, the more you have to lose before you lose it. So higher education or new learning, I'm not asking you to go out and enroll in medical school, although we could use more doctors, so feel free. But any kind of higher education we know is protective for our brains at any phase in the life. So this could be like this gentleman, he's learning how to do photography, learning a new language. I just recently read an article that was naming dancing, particularly learning new dance routines, right, as one of the most protective forms of physical activity that we can do for our brain. So we have Lynn Benton Community College, we have OSU. We're lucky in that sense. They have community education classes, and you can always enroll as long as you don't go over a certain number of credits. You can enroll as a community member, and you can learn about all the things that you had never had time to do before. Get some Z's. I wish I could sleep like this. My grandpa always did. I would worry about flies going in or something. So I think about this as like a computer, and I don't know if anybody has desktop computers anymore, but I know I did when I was going to OSU, and I got this fancy tower, my hard drive, and I got this slim flat screen computer screen, this fancy keyless mouse and keyboard, and I was all decked out. But if my tower doesn't work, then I just have a desk full of fancy paperweights, right? What do you guys do when your computer doesn't work besides hit it? What's your next step? Reboot, turn it off, right? We want to give it a rest. Let it kind of simmer and put things back together, get gathered again. That's how I think about giving our brains rest. Sometimes we have to power it down. We do a lot in our sleep. Our brains are really busy. So it's repairing that wear and tear of the day. It's also consolidating memories, okay? So if you don't get good sleep and you wake up the next day, you probably won't be able to remember a lot. Yeah. The piece with taking naps is just because there used to be a lot of information saying naps are bad, right? And as a clinician, when I talk to people about changing behaviors, health behaviors, we usually say if you're not sleeping well at night, stop taking naps, right? You're kind of cheating on your nighttime sleep. So we know now that rest of any kind is helpful and protective of the brain. So it also becomes significantly harder to get good sleep as we age, okay? So I want people to aim for the stars. 6 to 8 hours is ideal. Some of us have never needed that much, so just take into account what you know about yourself. But if you can supplement with naps at an appropriate time, obviously if it's 6 p.m. and you go to bed at 8, don't take a nap, please. Hang in there, okay? And also think about maybe some of the things that you're eating right before you're trying to go to bed. If you're loading some carbs or some sugary things, that's going to wire your brain and make it harder to sleep. But this is really important for memory and brain health, okay? We also want to manage our stress. That brain looks really uncomfortable. So stress is basically experienced for our brains as inflammation, okay? And we know inflammation is really harmful. So whether it's acute stress, something really bad happened, 3 weeks later it's over, it was probably a little bit inflammatory to your brain, but certainly those little stressors that we just have every single day, if we don't manage those can have a really bad impact too. So my recommendation is stop talking about building in stress reducing behaviors and actually make it part of your schedule. Find something that works for you. I do deep breathing. I have an app on my phone. It's called Calm app, and it's blue and white. Even just looking at the little logo on my phone, my brain is now synced up, and it knows when I go to press that button, oh, we're in trouble, aren't we? We need to breathe. So you can do all sorts of things, but every person is going to feel stress relief from different activities. For some of us, it might be pack up the fishing pole and head out, rain or shine. What kind of Oregonian are you, right? For others, it's I need to get down and have coffee with my friends. I need to purge, let it all out, and clear everything off and start again. So find something that works for you and just make sure that it's part of your routine so that you're getting that in no matter what. Stay engaged. So another hot topic in the aging and gero world is loneliness and isolation. We're learning more and more that this is devastating to our health. It's devastating to our quality of life. We have to stay connected. Okay, so social isolation is experienced sometimes as inflammation. It's experienced as an acute or long-term stressor. So some of us live in rural areas, okay, and we know that you're potentially more at risk for isolation and loneliness. This can be a perceived social isolation or loneliness, or it can be real, like geographically you are 5 miles from your next neighbor, okay? So you can volunteer for a good cause, whatever that looks like. You can start a coffee group with your friends, and please don't forget about all the technology that we have. Okay, I live 5 hours away from my family, and my sister has 2 young children, which I adore, and I get to Skype with them. So I can use my phone, I can use my tablet, I can use my laptop, and I can see them, and they can't get germs on me, which I really appreciate. So it's actually a really nice kind of situation we have here. I can still stay connected to my family and see them and hear them, and I don't have fingerprints all over the house. So if you don't know how to use the devices, if it's something that feels kind of foreign to you, again, there's classes at the community college. I think some librarians in town will even be willing to help you learn some of the basic skills. And kind of once you get into it, you'll pick it up more as you use it. It's one of those things where it's really frustrating at first. But don't forget about all the cool technology we have that can help connect us, especially if we have mobility or transportation barriers. Move it, okay? Reduces inflammation, helps to clear out some of those plaques in the brain, okay? Promotes new neuron birth in the hippocampus. Hippocampus is one of the places that Alzheimer's does its dirty work, okay? So this is really important for a lot of reasons. Again, we have that heart-brain connection. So if you take good care of your blood vessels and your heart, you're taking good care of your brain and vice versa, so, okay? Some of the positive side effects that you might experience from regular physical activity, even if that just means getting out some Dinty Moore soup cans in front of the TV and doing some, pump that iron, that's still perfect. It gets your blood flowing, okay? So do the little things. You might experience improved mood because that's going to help balance out some neurotransmitters, some hormones, and you might tire yourself out a little bit more and prepare your body better for sleep, okay? So what we know is trying to find a balance between aerobic and resistance and strength activities. And also you can just dance. Remember that. You can do that anywhere, anytime. Turn on your favorite song. Also, starting a walking group with friends is another idea. So you are what you eat. I grew up hearing it. My dad was a doctor all the time. Don't eat that, eat this, right? I had whole wheat bread growing up. No one ever wanted to trade me sandwiches. But it gave me a good platform to understand what healthy eating looks like. I steered a little bit away from that. As I was at OSU, I think I was eating 3 square meals of fast food. But it was cheap and it was quick, so don't do that. So again, we're coming back to this brain inflammation, okay? So some of the things we eat really inflame. So again, if we're making heart healthy choices, we're making brain healthy choices. That counts for food too. And this can sometimes act to preserve that brain volume that we would see, that shrinking and loss of volume. This can help with that. So one diet that kept coming up in my research was the Mediterranean diet. Have you guys heard of blue zones? Blue zones? So these are places in the world where they found people live a really long time and they're super healthy. I can't name off any of the places, but I know if you look up blue zones, then you'll see what I'm talking about. So Mediterranean, it's just the color. So yeah, BLUE and zones. And if you Google that, you'll find the main website for blue zones, and it talks all about kind of the behaviors and diets that they're using. So with the Mediterranean diet, kind of a basic guideline, it's pretty true. There's resources at the table for the My Plate for older adults. So it's kind of like your own specific food pyramid. But some of the guidelines are, we want you to have a ton of vegetables, some fruits, some legumes, whole grains. I'm over whole grains, but you guys should still eat them. I like the trashy white bread still, I don't know why. And olive oil. So I just think of this, when I look at the Mediterranean diet, I'm like, I'm so far away from that. I can never do it. So then I'm like, okay, well, I just won't change how I eat. And a lot of us find ourselves in that situation where, maybe we go to the doctor and they say you need to do this. Here's your after visit summary. Have a nice day. And there's so many things, and it can feel very overwhelming. And if we get so overwhelmed with where do we start, then sometimes we just don't. And so my advice would be, first go through these things, and absolutely for the diet piece, look at what you're already doing. If 5 years ago you switched out butter and margarine, you got rid of it out of your house, and you've been cooking with, olive oil or coconut oil, you're already doing something, okay? Avocado oil, yeah, those healthy oils, okay? But give yourself credit first and foremost for the things that you already are doing well. And then if you can just pick a couple things or just one thing to start with, right? We know it's really important for changing behaviors that we kind of pump ourselves up first and build up that momentum. We're kind of complicated creatures in that sense. So if we bite off more than we can chew, pun intended, then we might not be so successful, because we're saying, okay, unless we start eating the Mediterranean diet completely and have no slips tomorrow, then we failed, so we should just try something different, right? So we just want to say, well, we're going to do this part of the Mediterranean diet, and if we're successful, then it makes us feel good, and then we're going to keep working towards that goal. So try not to get overwhelmed in all of these recommendations. Also, fish and poultry, kind of those leaner meats. I'm a red meat girl, so this is probably the hardest sticking point, that and potatoes. And then some wine, as Dr. E said, in moderation, please. Because as we age, we don't tolerate alcohol like we used to, but we know there's some good protective factors in wine.
Red or white?
Red.
I believe it's red. Dr. E, can you speak to that? It's red wine, right? It has
Red is better.
Red is better.
Yep. They did find some benefits of white wine as well, but red has more of the antioxidants in it compared to white.
What about
Thank you.
beer?
Nice try. I see you in the Oregon State sweatshirt, so I get it.
I remember reading something about beer too, that there might be some different antioxidants in that due to the fermentation process. So actually there's a whole movement towards more fermentation foods. Beer, wine, kimchi, yogurt, kombucha, because of the health benefits of fermentation for our intestines, our gastrointestinal tract. So, well,
I think
let's give Helen a big
there was
round
one
of- oh, there was a
question over there, yeah.
Can I return briefly to the topic of naps? Is there an optimal duration of a nap?
The research that I found, it can be, some people feel really rejuvenated, and if you can power down in 10 minutes and take a 10-minute power nap, that's helpful. It takes me honestly about an hour to 2 hours to fall asleep because I am anxious and wound tight. So I think just take into account what you know about yourself and your sleep patterns. Even if you're not completely falling asleep, I think there's something to be said for, taking some time, powering down, being quiet, maybe just reading a book. Even that I think would be helpful. So there's not a set time that I found. Yeah.
Could you address a little bit inflammation of the brain, because it is a newer term to many of us. It's that you get an infected.
Sure. I would say inflammation of the brain is just like inflammation in any other part of the body. Dr. E, do you want to, if you want to do the physiological piece.
Sure.
I didn't do that homework, so.
So When we say inflammation, sometimes our mind automatically goes to infection. Infection is a process where you have virus, bacteria, fungus that is breaking down tissues of the body. Inflammation, though, is equally important, but it's different than infection. Inflammation occurs where we have different hormonal triggers or a cascading of different things that are going on into our body that are creating sludginess alongst the vessels, or sludginess alongst the connection of neurons, or sludginess anywhere. Think of inflammation as sludge. If you have sludge in any of your, let's think of pipes, your sewage system. There's more sludge going through pipes. It's harder to get everything through. Think of inflammation in that same regard. And there's different foods that are considered pro-inflammatory, foods that are considered to be less inflammatory to the body. Different types of medications that are actually pro-inflammatory medications that can reduce inflammation in the body. So there's more and more studies now looking at inflammatory responses of the body, and we think that this is a really important factor in people that have heart disease and strokes. It's not just high blood pressure and cholesterol, but it's the inflammation that occurs in those vessels that may trigger those heart attacks or strokes. So the question is about the removal of plaques. And so I'm gonna preface that in it depends on how big those plaques are. So they're a plaque that can just start to develop over time in our carotid arteries, but they only look at either putting a stent in place to kind of break up that plaque or removing the plaque in certain conditions once it's over a certain degree of narrowing. So just plaque on its own doesn't predict an increased risk of stroke. It's the degree of the plaque. But yes, once that plaque is there, after a certain degree, you can remove that plaque and have cleaner arteries going through either the carotids, or let's talk about plaque that has occurred at the heart itself.
Or the brain.
Or the brain.
We're talking about Alzheimer's at this point.
Thank you. So that type of plaque. So I was thinking in my mind carotid plaque, heart plaque, vessel plaque from cholesterol and inflammation. But the plaque that she was asking about was related to Alzheimer's disease and the change in this plaque and how it affects the nerve endings together. This is still under investigation. We don't know how we can reverse it, if there's anything yet that can be done. We know that medications for Alzheimer's disease may improve your cognitive thinking, but it doesn't do anything to change that plaque itself or change the progression of what that plaque is going to do. So, all right, well, join with me to thank Helen for a great presentation.